We're live on YouTube, and then we're going to go live on Facebook. And we should be in business. All right. All right, everyone. Good afternoon. Dr. Mike here. If you like my credentials, you can find them on our website, mikevantielen.com or easiermvtonline.com. Today, we will talk about stem cells one-on-one, and we're going to explore everything about stem cells and stem cell-based therapies, including sourcing, safety, manufacturing, mechanism of action, conditions treated, and all kinds of other cool stuff. Today, we do have a guest host, and his name is Chris Laney. So Chris is going to be the one asking the questions, and it should be a lot of fun and very educational. Before we get started, and I'll let Chris be the host, Chris, tell us a little bit more about yourself.
Thanks for having me on the show today. I was born and raised in Port Orange and went to Spruce Creek High School. Played soccer, went to Daytona State College, got my AA degree, and transferred over to the University of Florida. And I'm a senior, and I'm pursuing a degree in business.
I see you got your Gator shirt on. Go Gators, right?
Yep.
And what are you planning to do after you graduate with that business degree? What are your aspirations professionally, Chris?
I want to get a job either doing financial advising or something along the lines of being an insurance broker or something like that, just something in the business or financial region.
So you like numbers, huh?
Yes.
All right, very good. So Chris was interested in stem cell therapy, so I told him, you know what, instead of reading my book, why don't you be the guest host and ask me any questions that you desire to ask? So Chris is in charge right now.
All right, so the idea that stem cells could repair and renew any damaged tissue in the body still seems like science fiction to me. What are your thoughts on that, Dr. Mike?
Science fiction, that's always a cool word too. Well, we do live in a miraculous age today, and technology has advanced so much, especially in the last 2 decades of this century, that it actually approaches the technology that we have seen, and you're probably too young for that, in the original Star Trek series with Mr. Spock, or movies like Back to the Future and The Terminator. But it is no different for science and medicine and healthcare, because the advances that mankind has seen in the first 2 decades of this century, is more than the entire advancements that have been made in the 20th century. So science fiction is really becoming science fact today. A good example is over the last 2 decades, we have been able to use computer chips and plant those in the brains of Parkinson's people to help them with some of their debilitating symptoms. Another example is obviously children that are born deaf. We now can implant, they call them cochlear implants, into the brain so they can hear again. And today we have bionic limbs that are able to operate at much greater efficiency and strength than our own biological limbs. Almost like Steve Austin in the $6 Million Man. So as technology continues to advance, it makes more and more sense to merge, damaged human tissues with synthetic devices like computer chips to forestall the debilitating effects of aging and medicine. And that's where we are today. But if becoming the next modern day cyborg is not your cup of tea, we have something else. And that something else is regenerative medicine, because stem cells have the ability to repair, renew, and regenerate any type of damaged tissue in the body.
That's awesome. So my next question, I see that a lot of elderly people around me and in my community suffer from pain. It's scary to see that, but why is our current healthcare system unable to help these people?
So Chris making a great observation, and I work still a lot in physical therapy too. And it's indeed true that when we look at our elderly population, many of them are in pain. They have a reduced function, reduced range of motion, reduced strength. They usually have balance problems, walking problems. They use canes and walkers, and they cannot do the things they would like to do. Mm-hmm. And it's very sad. And, often, and I talk to many of those people, I ask them one simple question. And I usually ask them, if there was one thing that you wish you could do again without your pain or your medical condition, what would it be? And so often, Chris, people tell me, oh, I just want to be able to walk without pain, walk without a cane or a walker, walk the dog around the block. Or they mention their hobbies. I wish I could golf again, or go fishing, or play tennis, or swim, or dance, or do something outdoors. And often we hear, I wish I could play with the grandkids. We know the grandparents get on the floor with them, but then usually they can't get back up. Yeah. So when we ask them what the most precious commodities in life are, they always answer health and time. And so it's time for them to choose health freedom and regain control of their health. But your question was, why is our current healthcare system not helping these people? And I could go on for a whole day for many different reasons, because it's not healthcare, it's really sick care. But maybe 3 statistics of the World Health Organization will illustrate, how bad our healthcare today really is. And while we're in this COVID-19 pandemic, I'm not so sure if I can trust the statistics or the numbers from the WHO, but here we go. The first statistic tells us that we Americans spend more than 17% of each dollar on healthcare. For example, if we look at big companies like GM or Ford who manufacture cars, they spend more money each and every day on the healthcare of their employees than on the parts that they need to manufacture their cars. So that's alarming. Statistic number 2 is that America ranks number 37 in the world for overall health. Now, I came here in 1997, about 23 years ago, as a Belgian. Meantime, I became a proud American citizen. And to me, number 37 is simply unacceptable. What about you?
Yeah, that's
pretty a bad ranking, right? And so we do rank number 1, though, for crisis care. What is crisis care? Crisis care is acute care or emergency room care. So if you break a leg, you end up in the hospital. If you are in a car accident, you end up in the hospital and in an emergency room. You are in the best place in the world. However, crisis care accounts for less than 10% of overall healthcare. So it's the other 90% of patients or people that we're not taking care of, that we're not helping. And that's probably people with chronic pain, arthritis, neurological conditions and neuropathies, autoimmune diseases, and respiratory conditions. We just simply not are helping those people. The third statistic of the World Health Organization is that we Americans consume between 50 and 75% of all the drugs produced on this planet. We swallow more than 80% of all the painkillers, and we have about 259 million prescriptions for painkillers only per year. So it's fair to say that it's a fact that our healthcare system here in the United States is broken, and that people really need to look, if they do want to get better, look at alternatives such as regenerative medicine.
So just for our viewers, do you think you could explain what regenerative medicine is?
Sure. Regenerative medicine is basically a fast emerging branch of conventional medicine with the emphasis on restoring and repairing any type of damaged tissue in your body, mostly for patients and people who have serious illnesses and chronic pain in which the body itself cannot restore functionality. A good example is the fact that there now is a crisis in organ transplantations because our population is aging, and there's about 90,000 people on the organ transplant waiting list. So this creates a need to look in other and innovative therapies to provide for those patients. And so regenerative medicine, and especially stem cell therapy, is able to create new and living tissues for those patients.
Okay, that's awesome. So what about the research on these stem cells?
Yeah, research. Unlike common belief, there are thousands and thousands of peer-reviewed, published scientific articles all around the world. And actually, since 2015, the number of research articles just on mesenchymal stem cells, there's different type of stem cells. We can get into that a little bit later. But the type of stem cell that's most research is mesenchymal stem cells. So even if we disregard the research on all the other types of stem cells, since 2015, there's been more than 4,000 published research articles per year just on those mesenchymal stem cells. Now, that's more than 10 a day. That's more than any other topic in science or medicine. And that's because scientists agree that stem cells are the future of medicine. Now, these mesenchymal stem cells, they were discovered in 1976 by Friedenstein and colleagues in Germany. And so since then, each and every year, we see more and more research on those stem cells. But from the total amount of research, 2/3 of the total research has been done in the last 7 to 9 years. So you see how really this research is, booming for the appropriate reasons. Currently, the 3 main areas of research in stem cell therapy is number 1, developmental human biology, mostly in the areas of cancer and birth defects. Transplantations, we just actually went over a little bit because we are looking for an unlimited supply of organs and tissues that we can use to restore function in patients without immunosuppression. And then the third area that's really a lot of research in today is gene therapy. We want to signal the right genes so they promote the correct biochemical processes to provide long-lasting therapeutic effects. So that's where the research is today.
Okay. What are stem cells and what is their mechanism of action?
Good. We're talking about stem cells. It's a good question. What are they, right? Stem cells are very unique cells in the body. And like I said, they were discovered in 1976. So they've been discovered for a while. But Arnold Kaplan, an MD, PhD, is regarded the father of stem cells because he was the first one to look into the mechanism of action of these cells. So when he was looking and researching on how these cells work, he found that these stem cells were different from any other cell in the body because these stem cells have 2 cardinal properties. Number 1, they could replicate themselves. In other words, they can duplicate themselves. They can make perfect copies of themselves upon division. And number 2, they can differentiate into any specialized cell type in the body. What does that mean? That means that a stem cell can become a brain cell, a blood cell, a nerve cell, bone, cartilage, tendon, ligament, muscle, a pancreatic cell, a kidney cell, a liver cell, a heart cell, and the list goes on. So that's what stem cells can do. And because of that capability, he named those cells MSCs, standing for mesenchymal stem cells. Now, in the last few years, researchers have been doing more research into that mechanism of action. And so they concluded that the original school of thought is probably not correct. And so they found that these stem cells are not becoming other cells in the body, but they rather are promoting, stimulating, excreting all types of bioactive molecules. And those molecules are then used by the body to repair and heal itself. So Dr. Kaplan said, let's change the terminology of those cells then. And so instead of calling them MSCs, as in mesenchymal stem cell, he calls them now medicinal signaling cells because they have more of a signaling and promoting action in the body. But regardless on what we call them or what they're called or what the terminology is, we keep it simple to them. We call them stem cells, right?
Correct.
Good.
So I hear people talk a lot about the moral and ethical concerns in regards to the use of stem cells. Can you explain?
Yes, that's a very good question, Chris, because there's many people out there, even many healthcare professionals and also our politicians that like to dismiss the potential of stem cells in the future of medicine because they wrongly assume that all stem cells must come from the aborted fetus, and that's simply not true. There's many other different sources to get stem cells from, which I'm sure he will ask about later. Now, the stem cells that would come from the aborted fetus are called human embryonic MSCs or stem cells. And these stem cells always have been illegal and they're still illegal today to use in humans. And the reason for that is not necessarily just the moral and ethical issues going with those embryonic stem cells, but when they use those embryonic stem cells and tested them on mice in a laboratory, all those mice ended up with teratomas, which is a fancy word for benign tumors. So that's the reason why they always have been illegal and they still are illegal today, and they never will be used to treat humans because of that. So they're only used in research today. So actually talking about stem cells, embryonic stem cells, is actually a moot point because we're not going to use them anyways.
Okay. You mentioned different sources of stem cells. What are these different sources?
So broadly speaking, we have three sources of stem cells. We have allogenic sources, which means coming from humans. We have autogenic sources, meaning coming from the patient's own body. And we have xenogenic sources, meaning coming from animals. We won't discuss the xenogenic sources today because in the United States, we don't have any stem cell-based products that are coming from animals. So, those are basically the broad sources. The allogenic sources coming from humans are usually birth tissues. We got placenta, umbilical cord, and then obviously the embryonic sources that we just discussed that are not used because they're illegal. And then from the autogenic sources, meaning from the patient, him or herself, we could try to obtain those stem cells from our own adipose tissue, the fat, usually from our flank, or from bone marrow. And usually that comes from the hip. So those are the sources.
What do you think the best source for doctors to use would be?
Well, the best source to use. In order to answer that question, we'll have to look at a bigger picture here. Because everybody's always focused and talking about stem cells, stem cells, stem cells. But what we're really talking about is how are we going to repair and renew any type of damaged tissue in your body? And so that's a bigger picture. And that bigger picture is in science is called tissue engineering. So in order to effectively repair and renew a tissue in our body, yes, we do need those stem cells. But those stem cells, they need the support of other essential components in the body to get the job done right. And those components are growth factors, bioactive molecules, such as cytokines, hyaluronic acids, exosomes, etc., and scaffolding. The best analogy, Chris, here is probably that of, I use it in my seminars all the time, is that of a roofer. I know hurricane season is probably starting soon. Mm-hmm. Hopefully we're spared of that, like this epidemic is not, or pandemic is not enough yet, right? But if a hurricane comes through Florida, many people have roof damage. So if you have damage to your roof, you probably will have to call a roofer, right? Mm-hmm. So it's the same in the body. In order for the stem cells to go to work, they need to be activated, they need to be stimulated, they need to be called upon. So in the body, it's the growth factors that activate those stem cells. Without those growth factors, nothing's going to happen, okay? Now, let's say the roofer shows up at your front door, and he shows up without his tools. Is that roof going to be fixed?
No.
Okay. So in the body, it's the same. Those stem cells need their tools, or they can't repair anything. And those tools are your bioactive molecules, your cytokines, your hyaluronic acid, and your exosomes, right? And then last but not least, we need scaffolding. Scaffolding is the structure or the framework from which those stem cells repair, rebuild, renew, and regenerate, right? So what I want you to understand is, yes, we need stem cells, but all the other components need to be available too, or the job will be poorly done. We won't get any great results, right? So when you're asking what's the best source, I'll need to explain that all those products that are made, stem cell products, they're all made from a human tissue, as we already understand. And so based on the tissue that they're made from, that tissue will contain certain components that we need for tissue engineering, but it will be missing other components, okay? So they all have their advantages and disadvantages. Now let's talk about the stem cells that they try to procure from the patient's own body. Okay, in my opinion, those procedures, even though doctors are still performing them, they are outdated. They were popular 1 to 2 decades ago when the stem cell therapies just launched, but today they have many disadvantages. And so I like to share the top 5 disadvantages of undergoing a procedure to get the stem cells from your own body. So I don't recommend that, but here are the 5 disadvantages. Number 1, you will have to undergo an unnecessary surgery. And a surgery always comes with risks, pain, and a recovery time, right? And it's totally unnecessary. Number 2, if we take stem cells from one part of the body to then relocate to an injured area, for example, a left shoulder, all we're doing is relocating, but we're not adding anything to that. So a lot of the other components may be missing. There may be no growth factors, no exosomes, no scaffolding, right? And because those components may be missing, because we're only transferring stem cells, we don't get the results we want. Disadvantage number 3 is with these procedures, there's no uniformity, there's no standardization, okay? There's no quality control. What do I mean with that? if Chris comes in the office and let's assume we're going to try to harvest the stem cells from his hip, from his bone marrow, from his hip, and we harvest them after the surgery, we look under the microscope, we have a certain quantity and quality of stem cells, right? Mm-hmm. Now, let's say I come in an hour later and I get the same exact procedure, and we look under the microscope. Is the quantity and quality of my stem cells the same as Chris's?
Depends. I'm not really sure.
Probably not, no. So even if it would be, there's no quality control, there's no standardization, right? There's no uniformity of these procedures. And therefore, the FDA in November of 2017 put a notice out to all those clinics and physicians that they have to discontinue these practices by November of 2020, which is coming up. Okay, so these procedures will be illegal anyways. But disadvantage number 4 and 5 are the most important ones for you guys to understand today. And that is that as our body ages, and scientists agree on this, the number or the quantity of stem cells in our body drastically declines. Okay? Not only the number of stem cells in our body drastically declines, but also the quality, their ability to repair and heal drastically declines as we age. So when we get those stem cells from our own body, often we don't have ample or enough healthy stem cells to get the procedure done. And even if we did have them, they're like roofers that are old and can't even climb the ladder, so the roof never will be repaired, right? Gotcha. So there's plenty of research that you can find also in the book that we'll discuss later that compares these stem cells from an aging body to stem cells from birth tissue, which is the youngest possible stem cells, right? Mm-hmm. And so many disadvantages proven over and over again. So what you really want is young stem cells that are high in quantity and high in quality to get the repair job done. The best analogy here probably, Chris, is that of a young child that's playing around and falls and cuts him or herself, and we have a wound. How long does it take to heal?
A few days.
A few days. Chris is right. A few days, 24, 48 hours. What if your grandpa falls and cuts himself? How long does that take to heal?
Probably a week or two.
Yeah, he says a week or two, and sometimes more, even months. And that is because the healing capabilities of the youngster are at a peak. They have a high quantity and quality of stem cells that just repair and heal like that, versus the old person that has to rely on the sluggish and old and low quality stem cells. It takes forever to heal, if it ever heals without any help, right? Mm-hmm. So that's probably the best analogy. So I do not recommend, getting the stem cells taken from your own body. Many disadvantages, not only the surgery, but mostly a low quantity and a low quality of those stem cells. And yes, what do they do, Chris, if they don't have enough of them? They actually tell the patient to come back later that day or the next morning because they have to go to the laboratory and amplify or multiply those stem cells in a Petri dish in order to get enough of them. But research also has shown that when you take those old stem cells and multiply them, it's like taking a copy of a copy of a copy. Their effectiveness, their quality continues to drop, okay? So you need a lot more stem cells to get the same job done compared to high-quality stem cells from birth tissue. So let's not use those. So the other sources are placental tissue and umbilical cord tissue. Now, there's no moral and ethical concerns here because those tissues are after birth, okay? And normally they're disposed of, so there's no moral or ethical concerns. Now, when people make a product out of placental tissue, also called amnion, we actually have all the components for tissue engineering in that placenta. We have the growth factors, we have the cytokines, we have the exosomes, we got the scaffolding, we got the collagens, we got all of it. But we're missing one thing, Chris. The roofer himself is not there. Okay, so that's an issue. If we look at the umbilical cord, especially the Wharton's jelly, which is the gel-like connective tissue of the umbilical cord, that has been proving, according to scientific research, to be the best source of young stem cells. So they got the most young stem cells, high quantity, high quality. Okay. So now, when we look at those products, we always have components available, and we're missing other components. So most products don't have all the components for tissue engineering, which is an issue. Now, the product that we always use is produced by BioStem Technologies in South Florida. And the reason why I think it's a superior product on the market right now is because they use different or various tissues in their product to make sure they got all the components. So they use amniotic or placental tissue to make sure we have all the tools and the bioactive molecules and the growth factors and the scaffolding and the collagens. But they also put Wharton jelly of the umbilical cord in there because that provides us with those young stem cells. So when we have a product that combines the tissues, then we can get all the components that we need to get the repair job done. And that's why it was important to elaborate a little bit on what is tissue engineering and what components do we need. So when you ask questions, it's not just shouldn't be about stem cell. It should be about, are all the other components for repair of my tissue also present in the product that you're going to inject me with?
Okay. We talked about a lot of different components, but I wanted to zero in on exosomes. What are exosomes?
So yeah, you heard me talk about exosomes. As part of the bioactive molecules, the tools that the roofer needs, there's exosomes. And exosomes have really been studied intensely over the last 2 years because those exosomes, and the best way to prescribe it, they're like vesicles, they're like balloons. And those balloons, they contain all the tools that the roofer in this case may need, okay? Another way of looking at it is like a Home Depot. And if we put the Home Depot by your injured area, the Home Depot opens the door and the body can take whatever it needs out of all the aisles to get the repair and the renewal process started, okay? So that's an exosome. It's kind of the toolbox that the body needs and can select from to get the job done. Obviously, the exosomes do not contain nails and hammers, right? They contain lipids and proteins, and they contain microRNA, messenger RNA, and all the signaling molecules that the body may need to get the repair job done. So those are exosomes, your toolboxes.
Oh, okay. I hear that some athletes use PRP. What is PRP, and is that a form of stem cell therapy?
Yes, PRP stands for platelet-rich plasma. It's really not stem cell therapy, but a lot of people confuse it. So what is PRP? In a PRP procedure, they draw your blood, and then they spin that blood in a centrifuge, to separate the red and the white blood cells from the platelets. Then they're going to use the platelets. It looks like liquid gold. And they're going to inject those platelets into your injured area. Why? Because those platelets contain the growth factors. And we already learned that growth factors do what? They stimulate and activate the stem cells. So it's a very ingenious procedure, and it works very well on young people and young athletes, right? But as we get older, it doesn't give us the result we want because we are still relying on what? On our own stem cells. And we know that they go down in quantity and quality as we age. So it may work very well for young people. It may work very good in combination with real stem cell therapy to continue to activate the stem cells that we injected. But on its own, for people that are of middle age or older that want to repair something, it's certainly not the best choice.
Okay. Where do birth tissues come from?
So yes, the placenta, umbilical cord, the birth tissues, you ask where do they come from? They don't come from me, obviously. They don't come from you either, Chris. They come from healthy births of healthy mothers in U.S. hospitals only. So none of these products come from outside of the United States. And so normally these birth tissues, the placenta and the umbilical cord, they're disposed of, right? But now there are more and more hospitals that are certified or licensed to procure those tissues. And once they take them and don't throw them away, they're going to test them. They're going to test them for what? Any possible transmittable disease, communicable disease, infectious disease, molds, heavy toxins, and you name it. And so after testing those tissues, the majority is still disposed of because we're looking for what? We're looking for that perfectly clean tissue that cannot possibly transmit any human disease, right? And once we find that, perfectly clean tissue, it's donated to the tissue bank. The tissue bank will basically prepare it and sanitize it, put it in controlled lots, and then sell it to the manufacturer who's going to make a product out of those tissues. The manufacturer, usually the tissues are cryopreserved, right? And the manufacturer, once it has made its product, it requires by the FDA to do 2 or 3 steps of testing to make sure that the tissue doesn't grow any mold or bacteria, right? And as soon as those tests are done, and the tissue is regarded 100% safe, it goes in inventory, and then doctors or clinics or physicians can buy it from the manufacturer. So that's basically where these tissues come from.
Okay, so you said that they're FDA tested, so that means that these stem cell products are fully safe and...
So yes, one of the important questions that you want to ask if you're a patient or a prospective patient, you go to a clinic, where do your products come from and where are they made? And, I suggest they are made in an FDA-approved laboratory, right? So there's stringent measurements on safety and how things are done. Because these products, when they're made in an FDA-approved laboratory, they are considered 100% safe. Why is that? Because these products, or these tissues better, they are regarded universal tissues. That means that they're the same for any human being. Well, think about it. They're coming from the placenta and umbilical cord. So there's no DNA or genetic material from the mother and not from the baby either. It's in between, right? The umbilical cord. So they call it universal tissue, the same for all humans. So there's no blood fragments. So we don't have to do any blood testing to get these treatments done. There's no possible rejection and there's no possible allergic reactions. So it's pretty good news. There's no possible side effects with these products if they're made in an FDA-approved laboratory.
Cool. What conditions can be treated with these stem cell products? From a global point of view or a big point of view, anything could be treated with it, right? Because these stem cells repair and regenerate any type of tissue in the body. But in the United States, we're basically limited to treating chronic pain and orthopedic conditions like sports injuries, arthritis, those types of things, rotator cuff tears, plantar fasciitis, you name it, any orthopedic condition and arthritis. Neurological conditions and neuropathies, respiratory conditions such as COPD, emphysema, chronic bronchitis, asthma. We can do eye conditions, dryness of the eyes, and dry macular degeneration is where the studies have been done. And then there's chronic wounds, diabetic ulcers, and sexual dysfunction like erectile dysfunction in men. So those are the conditions treated. There are also autoimmune conditions that respond very well to these treatments, but that would be regarded off-label by the FDA. Okay. How does it fix orthopedic conditions and sports injuries?
So these products, they do have a strong anti-inflammatory effect. So when people get this treatment done, usually within a few days or a few weeks, they may have a significant reduction in pain. But that's not because those stem cells already fixed that knee or that shoulder, because that will take some time. It took a long time to, degenerate the joint or tear the joint or lose the cartilage. So it's not going to come back overnight. So for anything orthopedic, it usually takes 3 to 6 months to get the full benefit from these stem cell therapies in which they repair and regenerate and renew these tissues. Very important to understand, Chris, is that these stem cells, they just don't repair, they renew. So if you had a rotator cuff tear and you're 47 years old, I'm going to be 49, but this was when I was 47, it just doesn't repair it, it renews it. So it will be much stronger and resilient, more resilient than before. So instead of having a 47-year-old shoulder, you actually walk away with a 35-year-old shoulder, right? So it's not just repairing, it's renewing and re-engineering the tissues.
Okay. You also mentioned neuropathy. What is neuropathy and how do these stem cell products benefit neuropathy patients? So,
neuropathy. A lot of people in this country suffer from neuropathy. So let me explain neuropathy in my way. Because even the people that suffer from it, they really have never been explained what's going on. They just don't understand it that well. So I'm going to try to simplify it today. But first of all, what is happening in neuropathy patients? Well, all of us, Chris, whether we have neuropathy or not, from the elbow down in the hands and from the knee down in the feet, all of us have what we call small diameter nerve fibers. Now, in neuropathy patients, those small diameter nerve fibers, they are being killed off. They are dying off, okay? And so the more of those small diameter nerve fibers are being killed off, the worse the symptoms of those patients get. They get more numbness, more pain, more burning sensation, etc., more inflammation. But something else is happening. As more of those small diameter nerve fibers die off, their balance is affected. Because when I walk around and when you walk around, Chris, we don't have to look at the floor, right? Because there's a constant feedback from our feet, the small diameter nerve fibers, giving our brain constant feedback on what's going on the floor when we walk. So when we step on something, immediately we know, we look down, we adjust, and we don't fall. But if you're a neuropathy patient and you lose more and more of those small diameter nerve fibers, you don't get that feedback. And now your balance is going to be affected. You're going to fall. You're going to have an unsteady gait, and you probably then need a cane and then a walker. And it's a progressive condition that gets worse and worse with more balance and walking problems. So this is what's happening. The small diameter nerve fibers are being killed off. Now you may ask, who's killing them off, or why is this happening, right? First of all, we all have a brain, and the spinal cord is nothing but an extension of the brain. And at each level of the spinal cord, large diameter nerve fibers, they come out to supply that area. Now, these large diameter nerve fibers, they are protected. They are protected by a mailing sheath. It's like a wire that's insulated. But those small diameter nerve fibers in our extremities, they do not have that protection. And that's where the neuropathy attacks. You guys with me so far? Okay. Now, there's many causes, of neuropathy. One of them you may be familiar with. No idea? Diabetes, right? But most people with neuropathy are diagnosed with idiopathic neuropathy, which means cause unknown. But we know that all those unknown causes are toxins or toxicities. There's two good examples, actually. Number one, we have our cancer survivors. Many of our cancer survivors end up with neuropathy. Why? They had chemo, which is what? A terrible toxin, which causes those small diameter nerve fibers to be, killed off, and they end up with neuropathy. Another group of people that get a lot of neuropathy is our veterans, because they were exposed to Agent Orange, a toxin, and so many of them end up with neuropathy. Now, if you're not a cancer survivor, and if you're not a veteran, how come you have neuropathy? Well, nobody knows. It's a toxin that kills off those small diameter nerve fibers. So you may have been exposed to or ingested that toxin, maybe at a previous job you worked at, maybe at a place you lived. Nobody knows. But what we do know is that toxin in your body is now killing off more and more small diameter nerve fibers. Now, conventional medicine has no solution. There's no effective treatment, because all those thousands of doctors do and give those millions of people with neuropathy is they give them off-label drugs. They give them gabapentin, Neurontin, Lyrica, Cymbalta. And what are those drugs? Those are drugs for seizures, okay? So there's not even a medication for neuropathy, really, off-label use. Now, why are the doctors giving neuropathy patients these drugs? Well, number one, they don't have another solution. Number two, they hope that these drugs lower the pain level of those patients. And I have to be honest, Chris, I talked to hundreds of neuropathy patients, and so many of them without the drugs would have more pain. But whether or not these drugs help with the pain, the condition of the neuropathy simply continues to get worse and worse and worse, okay? So what would we have to do to really fix neuropathy? Two things would need to happen. Number one, we would have to restore the blood flow, the circulation in the extremities. And only when the blood flow returns, the small diameter nerve fibers, just like any other cell and tissue in the body, can repair and regenerate, okay? Because the blood has to bring what? The oxygen, the nutrients, and the tools for the small diameter nerve fibers to get better. And so in our clinic over the last 4 years, our number one treatment was neuropathy. And what we really saw objectively, because you can take tissue biopsies to look at the capillaries, we saw that those capillaries that were almost all dead, that the circulation returns in about 12 to 24 weeks to normal. And then once the circulation is restored, the small diameter nerve fibers start to regenerate. And when that happens, the pain, the numbness, the burning goes away, but the balance comes back too, because now the brain gets the feedback again while they're walking, and then eventually they can kick their cane and walk her to the curb. So it's very exciting to treat those types of people with neuropathy.
How do stem cells treat respiratory conditions?
Very good question. Doing an IV treatment with stem cells is also frowned upon and is off-label right now by the FDA. But if we would put these stem cells in your vein, where do they have to go first? The lungs and the heart. So if you would do that, you would get a great results, because all those stem cells end up in the lungs, okay? But we found a way around that, because now in the clinic, we use a liquid amnion. Remember, amnion is placental, right? Which is 100% sterile, 100% safe. And we do breathing treatments with a nebulizer. So the patients come in, 2 or 3 treatments with the nebulizer. these stem cells have a very strong anti-inflammatory effect. So it drastically reduces the symptoms, but they go to work and repair any damaged tissue. So we have seen great results with only 2 or 3 treatments with people with COPD that are on oxygen, 2 liters of oxygen per minute, you name it, emphysema, chronic bronchitis, and all kinds of other respiratory conditions. So very easy application, very safe application.
Okay, say I come into your office, and how would I imagine you do this treatment? In other words, how are these injections done?
So if you would come to an office, obviously, just like in any other medical office, you will have to fill out paperwork, medical history. The physician or healthcare professional will ask lots of questions, do an examination. If it's your low back, he probably has you bend forward and backward, poke around. The physician does its job, it's examination, right? Although after the examination, what should happen, Chris, is there should be a diagnostic component. In our offices, we had a sonographer who would use MSK, musculoskeletal ultrasound. I know everybody's familiar with ultrasound to look at the unborn baby. Is it a boy, is it a girl, right? Ultrasound is also often used in cardiovascular medicine to look at the arteries to see if they're clogged up and how much percentage they are clogged up. But we can use that same device, that same modality to look at the entire musculoskeletal system. And it actually has many advantages. Some of the people that do stem cell therapy use another device called fluoroscopy. Now, don't get me wrong, fluoroscopy gives great imaging, but it uses radiation. So we prefer ultrasound because it's 100% safe. And either way, there should be some type of an imaging modality to identify where the damage is within the joint or within that low back, right? So in this case, the ultrasound is 100% safe. It gives live imaging of all the structures. So when we have a joint, we can identify where the damage is. And then after the examination is done and the diagnostics are done, the medical team decides where that product goes and how much of the product goes in each of those damaged areas, right? Mm-hmm. So then they basically prepare the patient, create a sterile field, make the patient comfortable, and then they get the vial, the stem cell product, out of the cryogenic freezer. Every office should have a cryogenic freezer. It's liquid nitrogen. And so these products come out. It takes about 5 to 10 minutes for them to defrost. So it's not like a chicken breast you got to take out in the morning, right? It's a little bit faster. But once it's defrosted, the clinician needs to inject the entire amount, the entire product in the patient's body within 20 minutes. Okay, that's one of those FDA guidelines. But when we're injecting, we're going to use that modality, that ultrasound, to accurately place the product into those damaged areas. So the clinician is really not looking at your knee, for example, Chris. The clinician is looking at the screen, at the sonogram, and sees the needle going in to your damaged area. Let's say it's your medial meniscus, and inject it right into that area. So we feel that using a modality like that, we can accurately place the product, and it probably makes sense that we can put the product in the right place. We get faster and better results, right?
Yeah.
Okay. So that's what happens. Most people need 1 or 2 treatments, and you have to be a little bit patient because, like I said, it may take 3, 6, even 9 months to get the full benefit of the repair and regeneration process of these types of therapies.
Are there any side effects to these treatments?
No, no from the product. We already established that the product is 100% safe, no possible adverse reactions from the stem cell product, but we're doing injections. So there's always a possibility of bruising and swelling, and actually a very small chance of infection as with any other injection. That's basically it. So very safe.
Okay. Are there any other therapies or modalities used in conjunction with the stem cell injections?
Very good question again, Chris, because actually it's very important to understand that, there's never one therapy or one product or one supplement or one drug that just simply, fixes everything, right? So the question is, besides these injections of the stem cell product, which are called allografts. Allografts is a fancy name for a human tissue, right? Besides the injection of those allografts, is there any other therapies or modalities that would synergize with that injection and optimize the results? And there's several, Chris. We use shockwave therapy in the past, which is very effective in conjunction with stem cell therapy. We can consider medical marijuana and CBD oils. That's going to be another total different podcast, but based on the pain level and based on what's going on with the patient, these CBD oils or medical marijuana may help in conjunction with the stem cell-based therapies. We do a lot of infusion therapies, which mean IVs, right? I think infusion therapies are underutilized in conventional medicine because what's the purpose of doing an IV? It's bypassing the digestive system to make sure there's 100% absorption, right? So why wouldn't we use that more often? If you end up in the hospital or in the ER, before they even do any tests, they already put you on an IV for hydration, right? And so it should be used more often because why? If someone is in pain, why not put anti-inflammatory nutrients directly into the vein to get pain relief? Why not use antioxidants to combat free radical damage? Why not use amino acids to provide, building blocks to repair or to, combat muscle atrophy and those types of things? So it's underutilized. So many times in a good clinic, they will combine infusion therapies with the stem cell therapies. And that's about it. So yes, there are other modalities that would be beneficial to combine with stem cell injections.
Okay. I have a question about shockwave therapy. Could you elaborate on that topic a little?
Never heard of that, huh?
No.
Shockwave therapy, it's basically shockwave therapy. I'm going to try to keep it simple. It's an acoustic therapy. In other words, they use sound waves. And these specific sound waves, they create peaks. And those peaks are called shock waves. Now, according to scientific literature, these shock waves, these peaks, have 5 physiological effects on the body. Number 1, they shut down inflammation immediately. What that means is that most of our patients leave the office with a lot less pain, which is not a bad thing, right? Mm-hmm. Number 2, it increases the blood flow, not temporarily, not just while we're doing the treatment, but sustained. And everybody knows that's listening, that blood flow or circulation is important when we talk about healing and repairing, right? So it creates a healing environment. Number 3, and this is the reason, Chris, why we came in contact with this piece of equipment and learned about it, because we always do research on stem cells. So it stimulates stem cells, okay? And number 4, because it stimulates stem cells, it has been shown in scientific research to increase and improve tissue healing and tissue repair. And number 5, it also, this is good for athletes too, it increases muscle mass and muscle volume in athletes, right? So those are the things it does. It's 100% safe. There's no possible side effects. It has been FDA approved for about 1.5 years now. So in America, it's pretty new. The equipment is made in Germany. But let me back up. There's many companies that promote shockwave therapy, but their equipment really doesn't produce shockwaves. And there's lawsuits going on now because they use that, they kind of deceive the public, the patient, that they have shockwaves, but they're not shockwaves. If you want to know more about it, it's in my book. You can always contact me. But the one and only shockwave therapy out there today is called soft wave. And that device is made in Germany. And so in Germany and Europe, they have been using this therapy for decades, not just on patients, but professional athletes, etc. And so again, it has been registered with the FDA for 1.5 years now. And high-end medical institutions like the Cleveland Clinic, but also pro sports teams like the Cleveland Indians are using this equipment on the athletes because it works so well, okay? It also has a diagnostic component. Remember, we use the ultrasound to visually find the damaged areas. Well, this piece of equipment identifies where referring pain originates. For example, if you have sciatica, meaning back pain going down the leg, the doctor usually has a very tough time figuring out where that nerve is impinged or irritated. Is it the low back? Is it the sacrum? Is it the piriformis muscle? This piece of equipment identifies the origin of pain. So we know exactly where to inject and where to treat to get rid of such referring pains. So it's a very effective piece of equipment that works by itself. But in combination with those stem cells injections, what we have seen is amazing results because they work synergistically. We inject the stem cells, and the soft wave provides a great environment with increased blood flow and stimulates the stem cells. And usually we do about 3 treatments. So a week after, we do the shock wave again, and we stimulate the stem cells again. And a week after, we stimulate the stem cell again. And so you can see that we have good short-term results, but also have better long-term results with combining those 2 therapies.
Okay. What is the success rate of stem cell treatments?
A good question. It probably depends which clinic you go to, right? But when we talk about success rate, it's very individualized, meaning if you are healthy, if you are eating right, and you are young and vibrant still, you're going to respond very fast and very good. In our clinic, we have treated many professional athletes. We have treated people that came from Jamaica, from Sweden, flying in because we believe we have a product and procedures that are a few steps ahead of the competition. So we have treated NFL players. We have treated retired NFL record holders. We have treated Riddick Bowe. I don't know if you heard of Riddick Bowe. Big Daddy. He was the undisputed heavyweight champion of the world. He actually fought Evander Holyfield, who I met personally too. Awesome guys. He fought Holyfield 3 times and won twice. So he came for treatments, effectively treated his knee and his shoulder. We had Pinklon Thomas, another 2-time heavyweight champion of the world that we have treated effectively. And, many professional athletes. Ron Dixon, he's a New York Giant, NFL record holder. And so those people are still in shape. They're athletes. They respond very well. If we talk about people... It seems like the screen is frozen. I don't know if it's the same. Little break here. On YouTube, it seems to be okay. So we're good. We're going to continue. But if you're an older person, if you're in your 70s, if you have a lot of other medical conditions, if you have diabetes type 2, if you smoke and drink, you less likely are going to get great results. Now, when I look back at the 4 years that I was involved with stem cell therapy, I'm not longer affiliated with an office that provides those services, although I can recommend and help you finding the right office with the best medical teams, with the most experience. But, I would say reflecting back, it seems like this type of therapy in our office, you either respond very well and it works like a miracle, like, oh my God, all this year I've been suffering, I tried everything under the sun, and boom, it's better, it's gone, right? Or you don't respond at all. It doesn't seem like, it's 50% better. You either respond or don't respond. And I would say, to be honest, because I could lie and say we have an 80% success rate, but it isn't true. I would say we had a 50% success rate. So for the people that came and underwent the procedure, which is 100% safe, so nothing can get worse, 50% of them, it was a miracle. They got rid of their ailment, their neuropathy, their knee got rebuilt, and it didn't have any knee pain. They prevented total knee replacements, etc. And for the other 50%, it just didn't work for whatever reason, okay? So that's the reality of it. Now, 50% is not a bad rate when you think you only need one treatment and the results are lasting, right? You don't have to keep going and treating it.
So I heard that you aren't affiliated anymore. Could you recommend someone who is interested and just recommend a good office or clinic to them?
When our listeners want to go to a clinic, there's certain questions that they certainly need to ask to make sure that they're at the right place. And we'll talk a little bit about the book here. This book is a consumer guide. It doesn't, promote any particular products or manufacturer. It doesn't promote any clinic. It's really 7 key questions that you should ask when you go to any clinic to make sure you're at the right place. So besides having the right product with all the components for tissue engineering, besides making sure they have some kind of a diagnostic modality like an ultrasound or fluoroscopy, it's also very important to make sure you ask questions about the medical team. In other words, who is doing the injections? Hopefully it's a doctor or a nurse, right? And then another question would be, how many treatments have they done? Hopefully if they have done a few hundred treatments already, you don't want to be the first one, right? Yeah. You also would ask whether they are certified and trained in these specific procedures. Did they get specialty training in these procedures? I also would ask, for example, is the clinic a member or a part of some kind of an association or a physician group? Because when we talk about stem cells and regenerative medicine, it's not settled science. It's evolving on a daily basis. So you want to be in contact with other experts in the field, and make sure that you are continue to update and upgrade your procedures and your products so you stay on the cusp of this very innovative technology. So those are the questions you need to ask about the team. Another question probably is, what is your success rate? Not is just what is your success rate overall, but if I'm a neuropathy patient, I would ask, how many neuropathy patients have you treated? And what is your success rate with neuropathy patients? So many questions to ask. And, our book, which we'll talk about probably very shortly because we're going to wrap it up soon, will give you the key questions that you need to ask to make sure you're at the right place.
Okay. I want to ask you about the policies of the Federation of State Medical Boards.
Good. That's another key component here. In April of 2018, the Federation of State Medical Boards adopted a policy, and they do that to protect the patient, okay? Because every time there's a new therapy that becomes more mainstream or more popular, but insurance doesn't cover it, guess what? Especially the elderly people may take an advantage of, because people are in pain. They are desperate, so they want to try anything to get better, and often they're taken advantage of. So this policy was put in place to protect the patients. And so it's very important to ask if the clinic knows about the policy and if they're advocates of that policy. To give you a few examples of the policy. So we always would encourage an informed and shared consent. We all know what an informed consent is. It's the paperwork that we sign before we do a procedure. But informed and shared means that a healthcare professional actually sits down with you, Chris, and goes over each and every one of those paragraphs to make sure you understand them versus signing something that you don't even read, right? So what's in that informed and shared consent? First of all, these procedures are elective procedures. So it's not that they have to do this procedure. It's not a medical emergency. Number two, these procedures are not recommended when the patient did not try the conventional and proven methods for their condition. For example, if you come with arthritis for the knee, our question should be, have you had physical therapy before? Did you try cortisone injections before? And if all those conventional approaches failed, then you may be a candidate for stem cell therapy. If not, you should try those first, right? Mm-hmm. Another very important case that this policy makes is that the practitioner or the clinic should not treat any conditions that have not been proven beneficial by scientific research, okay? So we discuss the conditions that we treat, but if they come in for some kind of a weird syndrome or something that has not been proven to be effective, then they shouldn't be treated with stem cell therapy. And so there's many points that this policy makes. And so a good clinic should be an advocate of those points and do not take advantage of people that are desperate and take their cash, okay? That's just not nice to do, for sure. So I think it's a very important question to ask, because many of those stem cell clinics, if you will, they would persuade patients with video testimonials of patients, or they persuade them with case studies. What really needs to happen is that they discuss the research, the benefits, and the possible liabilities or risk that the patients take versus try to persuade them with testimonials. And that's what that policy is about.
Okay. How come these stem cells are not covered by insurance?
Yes, well, it's not that the insurance doesn't want to cover them, but to make a long story short, every time when there's a medical condition or a symptom, and we have a possible solution, whether that is a drug or a therapy, in America, it takes on average, and this is just a statistic, 23 years before Medicare and commercial insurance covers it. Why does it take so long? Well, first of all, we have to do some case studies and make sure there is a possibility that it works. Then we have to invest millions to do clinical trials or FDA studies, which takes years. And then when that's all approved, then the insurance companies may look at it, but they don't have to, okay? So on average, it takes a long time for them to become approved. So when it comes to the stem cell therapies, we're kind of halfway there, okay? Because the FDA told all the manufacturers of these stem cell products that by November of 2020, this year, they have to initiate their clinical trials or they're out of business. So the FDA is pushing them now to do those clinical trials, okay? So that's all good news. But here's the problem today. In the 1970s, 80s, if we had to wait 20 years, we wait 20 years. But today, and that's how we started off this podcast, today, technology, medicine, science advances so fast that we don't have time to wait 23 years. By the time these products or these procedures are approved and insurance covers them, guess what? They're outdated. There will be better things available. I will be talking next year on a podcast with you about something better, and I may be saying that this is outdated, right? So we don't have the time. So why does it have to take so long? Nobody knows. It's all about money, greed, and bureaucracy, right? Because within the United States of America, if we have a problem, like now the COVID virus, right, we should be able to come with a solution within a year and test its safety and effectiveness. It doesn't have to take 23 years. But regardless, that's where we are. So yes, they are starting the clinical trials. At some point, it will be covered by insurance, but it may be still 7 years from now, and by that time, probably it's outdated and you want something else that's not being covered by insurance. So right now we're looking at out-of-pocket expense, but if it works, it changes people's life. Most of those clinics, they have payment plans, so you have a monthly payment versus paying up front, and the prices today are really affordable for most people.
Okay. So we spoke a little bit about your book. It's more of a consumer guide, Stem Cells 101. How can the audience get their hands on a copy?
So yeah, this is a very easy to read book on stem cells, covers most of what we talked about today and more. It's explained in layman terms, very easy to understand, and it basically reviews the 7 key questions that we need to ask when we are considering regenerative medicine or stem cell therapies. You can go to my website, mvtonline.com or mikevanthielen.com, go to the About page, go to the Other page, and all my books are there. And so you can purchase them from there. The ebook is only $2.99. The actual paperback here is $9.95. Now, I do have to mention, Chris, when people buy these books, Amazon or Kindle Direct Publishing, they make most of the money on these books. I do get a small commission, but I want everybody to know that for the last 5 years, I've been using those commissions to donate to charities. For example, Children Incorporated is the charity that I monthly donate money to. So I'm not selling these books to make $1 or $2. These are really educational. It's a very good consumer guide to make sure you ask the right questions when you are considering these types of therapies.
So if our viewers have any questions, how can they get into contact with you directly?
So yeah, you easily can get in contact with me. If you're watching this on Facebook, obviously you can message me there. But otherwise, go to the same website, mvtonline or mikevanthielen.com, and you can call from that website or you can email me from that website. I'll be glad to answer any questions about what the best products are on the market today, what clinics I would recommend or not recommend. And again, I'm not affiliated with any stem cell clinics anymore.
All right, that's all the questions I have for you.
All right, Chris, thank you very much for being the guest host. We wish Chris good of luck in his senior year and in his future endeavors. Hopefully this was very educational for you guys. Tomorrow we have Michael Brodsky on, and he will call in, so he will be on a big screen TV sitting next to me, and we will talk about his book, Incremental Improvements. It's basically on how to step-by-step reach your goals and work on your dreams. Very interesting guy, so we'll have him on tomorrow. I'll be the host again. Wednesday, we'll have Jody Jody Bear with us. She's a cancer survivor. She had stage 4 melanoma many years ago. She didn't opt for conventional treatment, no radiation, no chemo. They gave her only a few weeks to live, and 10 years later, she's still with us because me and a colleague of mine, we put her on a juicing and healthy nutrition program, and she's doing very well. So we're going to talk about cancer. We're going to talk about juicing and nutrition. And hopefully by the end of the week, we still have to confirm we have a surprise guest. He is a NFL player, Leon Searcy, a very famous player. He's still a radio host and announcer for the Jacksonville Jaguars. So hopefully we hear his story by the end of the week. So this was our podcast. Thanks for listening. Choose health freedom.